Hello, I'm Dr. Jeanelle de Gruchy and I'm Director of Public Health at Tameside. COVID cases remain high in Tameside despite the recent encouraging reductions. So it's important to remain cautious in what we do so we can continue to reduce that COVID transmission. All the evidence shows that the vaccines are highly effective against having COVID with symptoms or severe enough COVID to be hospitalized or unfortunately to die from COVID. So it's vital that people get their life-saving jab. Also, the vaccination is reducing the amount that COVID is actually spreading. So I'd urge younger people to get your jab, which will help you to enjoy all your summer plans, such as festivals, holidays, and socializing, hopefully outdoors as much as possible. Now, for women who are pregnant or wanting to become pregnant, the evidence is increasingly clear. Pregnant women are at greater risk of serious illness if they get COVID, and currently there are a significant number of pregnant women in hospital with COVID, and sadly, 95% of those are unvaccinated. Also, we know that those pregnant women who do get COVID with serious symptoms are twice as likely to experience a stillbirth and 3 times as likely to have a preterm baby. The Pfizer and Moderna vaccines are recommended for pregnant women in the UK because these vaccines have been given to over 130,000 pregnant women in the US, and the data has not raised any safety concerns. More than 50,000 pregnant women in the UK have received at least 1 dose, which is encouraging. But I'd strongly urge everyone to take up the vaccine. It is now clear that it is the best way to keep you and your baby safe. Local vaccine hubs will be open on set days in the early evening throughout August, so that as many people as want to can get vaccinated this summer. Details of when they're open for drop-in for the first or the second dose after 8 weeks can be found at www.tameside.gov.uk/COVID vaccine. That webpage also contains details of our pop-up clinics when anyone over 18 can also drop in without an appointment or ID for their first or, as I say, after 8 weeks, their second dose. If you want to book an appointment at one of the hubs or pop-ups, just head straight to the booking site, which is www.tamesideandglossop.nhsvaccinations.co.uk, or you can call your GP practice. Alternatively, you can book at one of the mass vaccination centres via visiting www.nhs.uk/coronavirus-vaccination or by calling 119. It's still really important to continue with the basic measures of washing hands, wearing face coverings, socially distancing, and letting in fresh air. If you do have symptoms of COVID, such as a fever, a new continuous cough, or loss or change of taste or smell, then you really must book a PCR test. Visit www.nhs.uk/coronavirus for information. And we all need to test ourselves regularly. Please continue to use the rapid tests twice a week. This is to check whether you may be infected with COVID but don't have symptoms. This can be the case even if you have been vaccinated, so you could still be infecting others. So please keep testing with the rapid tests regularly. These tests can be ordered online or collected from different venues in Tameside. And for details of these, visit www.tameside.gov.uk/rapid testing. So things are looking more positive, but please remember that people are still getting very poorly or even dying from COVID, or they might actually experience long COVID. So we all need to continue doing everything we can to protect ourselves and others.